Today, we're talking to Jennifer Fopma from Cedar Creek Hospital of Michigan. Welcome to Studio 10, Jennifer.
Thank you. My pleasure.
Well, first, let's talk about Cedar Creek Hospital and where you guys are located. Could you tell us more about the hospital?
Cedar Creek Hospital is located in St. John's, which is just about 20 minutes north of Lansing. We are a standalone hospital. We have about 54 beds, half are adolescent and half are to treat adults. The campus is beautiful. It's clean, it's warm and inviting. Of course, it's sanitary and sterile, but it doesn't give you that feeling. We have open courtyards for our patients to use. And a typical day involves seeing your doctor, seeing your therapist, and really a host of group therapy sessions that teach new skills, things like traditional talk therapy, but also more expressive therapies like yoga, art therapy, meditation. We have a dietitian that comes in and does some education about how food, what we put in our body, impacts our mental health. We have dance movement therapy. We have pet therapy. So really a whole opportunity throughout the day to learn new skills, to connect with other people who are experiencing the same things you are, and just feel enhance the medication that the doctors are using.
And let's talk about the therapist, because you guys have an extensive professional staff there at Cedar Creek Hospital.
Yeah, every one of our clinicians is a master's level social worker. All of our art therapists are certified. They all have degrees and are certified. Our dance movement therapist is a specialist in her field. The dietitians are registered, the yoga therapist. So everybody that we have here is really the best at what they do.
When it comes to the pandemic in the last several months, there has been a major focus, a kind of shift, if you will, on mental health, but there still is that stigma involved. How do we break away from that stigma of mental health?
Yeah, it's a shame because stigmas really prevent people who need help from getting the help that they need. I don't think we think twice if we worry we broke a leg or we feel sick to go to a hospital or go to a doctor. But when it comes to feeling overwhelming anxiety or depression, somehow we think we have to solve that ourselves. And that's absolutely untrue and very hurtful. Our brain produces a lot of chemicals and sometimes they just aren't producing it. So we physically can't just solve it ourselves. We can't just get happy. We can't just relax. So coming to the hospital really can save your life. People don't come here for friendships, but a lot of times they really connect with others while they're here. We have staff that are available 24 hours a day to make sure everybody is safe. And so the stay isn't even that long. 7 to 10 days is probably the average, but it really depends. Some people are here 2 or 3, and some people stay a little bit longer.
All right. Well, Jennifer, if people want to know more about Cedar Creek Hospital, how can they find out more?
You can actually just walk into the hospital like you would a medical hospital and get a free assessment. And we're at 101 West Townsend Road in St. John's, or give us a call, 989-403-6022.
And speaking